our friends from press, our Managing Director, Mrs. Sunita Reddy, and our clinical lead cardiac, Dr. Ganapathy Cardiac anaesthetist. And really is a remarkable day today. This press conference to announce that the clinical excellence of Apollo Hospital, especially leading the way in performing the robotic-assisted minimal invasive coronary artery bypass surgeries and saving lives of many patients. And we have really happy to see patients who are older and who otherwise would have difficulty without undergoing this surgery. We have a 93-year-old gentleman undergone cardiac CABG surgery, the robotic CABG surgery. He is the oldest patient reported to have undergone cardiac surgery in India. We have many more patients with us today, and elderly gentlemen, they underwent cardiac, robotic cardiac surgery. Apollo Hospital is known for the clinical excellence over the last 4 decades. Apollo always the first hospital to bring new technology, new services to this country. Our chairman, when he started our hospital in Chennai to bring the international standard of care to the reach of every individual of this country, true to that vision, today we have this cardiac robotic surgery program in Apollo Hospital. Apollo Hospital is the first hospital, thank you sir, Apollo Hospital is the first hospital to introduce cardiac robotic surgery under the leadership of Dr. Yusuf. Dr. Yusuf was trained after his masters in Stanley Medical College. He went to UK, got trained in minimal access cardiac surgery, and he came back. His vision to align with our chairman's vision. Chairman's vision was to give best cardiac program to our patients, and Dr. Yusuf exactly has done the same thing, and he brought minimal access cardiac surgery. And minimal access cardiac surgery, Apollo Main Hospital is a leading center, and robotic surgery, the first robotic surgery done in our country in Apollo Main Hospital, Chennai, and Dr. Yusuf taken up because when we think cardiac surgery, people are worried, because risk involved, especially when we do elderly people. People think that elderly people, okay, we can medically manage, we can put a medication for long term and observe, and if there is any cardiac failure, we'll manage cardiac failure. But going and helping those patients, making them free from pain is something unique, and that to get those surgeries done in few days. Unlike earlier cardiac surgery, when patient undergoes surgeries, even the population of middle age group, they stay longer time, 10 days in the hospital. Now we have a gentleman, Mr. Chellaya, 92 years old. Thank you sir for coming here, being part of this program and helping us for this awareness to the elderly people that they can undergo surgery even at this age. And we have Mr. Achudaya. Thank you sir for coming here, being part of this program. This all will encourage many of our patients in our country that age is no bar to undergo surgery and get free from pain. So that is exactly Dr. Yusuf has done, and I really appreciate Dr. Yusuf for taking this program, initiating this program in this country. And you are the one who started the cardiac robotic surgery program in India, and the outcome is outstanding. I have seen the bilateral mammary done number of cases is more than European countries put together. I think that is amazing and really appreciate. I also appreciate Dr. Ganapathy is here, his team anesthesia, because this is a team effort and everybody is together. It is surgeon, anesthetist, and nurses and technicians, and together they work and get the patient get better and go home faster. So these patients, Dr. Yusuf was feeling that they were discharged in 5th day, 92 years old gentleman after major cardiac surgery sending home after robotic surgery. It is really remarkable. I really appreciate, and we are happy that we are the first center to start robotic surgery, highest number of cardiac surgery, robotic surgery done in our center, and that to total arterial graft. So that is something amazing. I mean, doing a total arterial graft for these patients is giving a for longer time for those graft, so that they live longer, and that to arterial grafts, that is very important, bilateral arterial grafts. So I am really happy to be here to welcome all of you, and my thanks to our managing director for being part of this program, press conference, and she has been a global leader in healthcare, and she has been inspiration, support to all of us to do many more innovative, new, technically challenging procedure in our hospital, not only in main hospital, hospital across all 70 hospitals in our country. Thank you, madam, for your presence here, and it really motivates all of us. Thank you. And our friends from press, once again, my sincere welcome and thanks to you, because you always support us, because this is your presence here, and you take this message across the country, not only in our country, because many countries around India and even countries, Middle East, Africa, depends on Indian healthcare, because the Indian health tourism is expected to boom, and the message is get across the globe. Your support and your effort with your contribution in that makes a great difference to patients, not only in India, around the globe. And thanks once again for all press members.